Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Our program today is on healing chronic wounds. Joining us for this discussion is board-certified infectious disease specialist and medical director of the McLaren Wound Healing Center, Dr. John Brooks. Dr. Brooks, welcome back to Today's Health.
Thanks, Barb. It's great to be here.
Are there steps that a wound normally goes through when it heals?
Absolutely, and you actually know what they are because you know when you fall, you get a cut in the garage or the kitchen, you get a scab. The scab forms over the wound. 6, 7, 10 days later, the scab falls off and you're healed. What we don't think about is that scab that's on your wound is a biologically active live part of your body that's healing your wound. There's all this stuff that's going on. Think about little builders that are underneath the scab that are working, that are building your flesh, putting things back together. And so when that scab comes off, you're healed. And we don't even think about that. That's the normal process that happens with us. If you have surgery, we cut you, we sew you back together. 7, 10 days later, we take sutures out or take staples out, and you're healed because that's the normal process. The problem comes, of course, is when somebody has something else going on in their body and the wound will not heal. It doesn't do the 7 to 10 day thing, and it just doesn't heal.
Is that the normal amount of time that most wounds heal in, is about 7 to 10 days?
You would think so, yeah. And again, if you've had surgery, you've had an injury, you kind of know that, that scab falls off a week, 10 days. In surgical, you go back and get your sutures or staples out 7, 10 days later. That's about the normal time frame.
So what makes a wound chronic then?
So we have a specific definition at the Wound Healing Center. Is we use about a 30-day cycle. Mm-hmm. There are people, depending on what's going on in their bodies, that they'll slow their healing down. But if you go about a month and your wound isn't healed, we call that a chronic wound, and it's going to need a lot of extra help to heal.
What are the common types of chronic wounds?
So there are certain types of patients that are more likely to get a chronic wound, and our number one are people with diabetes. Diabetes creates a really difficult environment for the body to heal. The blood sugar issue is part of it, but there's also the blood vessels. People who have diabetes, their blood vessels aren't healthy, and so then they don't perfuse their tissue as well, and they don't heal as well. Patients that are medically fragile, people who have had chemotherapy in the past, that have had radiation in the past, people that have chronic illnesses, people with like lupus or other autoimmune diseases can have wounds that just simply don't want to heal very well.
And so then that wound may become chronic. What happens in the quality of life of a person and the health of a person who has a chronic wound?
So let's talk about a common will be a diabetic. So we have a lady or a gentleman that has a wound on their foot. So if you're diabetic, what are the things that we ask people to do? We want them to be active. We want them to walk. We want them to do their regular everyday activities so they're healthy and active. You put a wound on your foot, you can't walk. Mm-hmm. So now all of a sudden you're not ambulatory. You can't go to the store. You can't go to church. You can't do your day-to-day stuff. Your activity level falls. You become weaker and you become sicker. So chronic wounds have a great impact on people. We think about diabetics.
At what point do you advise people to seek treatment if they have a wound that isn't healing?
So at the Wound Center, we use that 1 month mark. So at the Wound Healing Center, you can be referred either from your physician or you can self-refer yourself into the Wound Center by calling the Wound Center. And if you've had a wound for 30 days that isn't healing, we'd be happy to see you and try to see what we can do to help you get better.
Are there always underlying conditions, or could just someone who is, a healthy individual get a wound that won't heal?
So I can't be too personal about that, but I can give some little stories, is that younger people who have severe trauma, people that, let's say, are skiing, or people that are on a motor vehicle of some type, like a motorcycle or an ATV, that fall off of those and they break their limbs or hurt themselves severely. They're usually hospitalized, multiple surgeries. The wounds they have sometimes are really difficult to heal, and we'll take care of them. And they're completely healthy people, but they've had a significant event that's happened. Most other people that have a wound that doesn't heal, there's a medical reason. It's the diabetes or a chronic medical condition that just makes them not healthy, and they have a hard time healing. And of course, there are some medicines that people take that then affect their ability to heal. People that have any kind of cancer, because chemotherapy slows down healing, and people that have autoimmune diseases or other diseases where the immune system is overactive and they give you immunosuppressants that slows down the immune system and that slows down healing.
Are most people aware that they're kind of vulnerable to have a chronic wound if they have some of these things, or is that a surprise?
So I think most diabetics have gotten that clue if they see their physician regularly. Part of the national guidelines when you take care of a person that has diabetes is foot care, and so they are instructed to daily examine their feet, and if they do have a wound that doesn't heal, they're supposed to contact their physician. That is a common guideline across the board for people with diabetes. It's a little more difficult with other disease states, though.
Well, we have lots more to talk about, but first we're going to take a break.